Okay, well, good morning, everyone. Thank you for joining us today and introducing yourself in the chat. It's wonderful to see so many people here at our second webinar series for school mental health. We appreciate you joining us today as people continue to onboard and welcome each other in the chat. I'm going to give just a few announcements to get us started so we can turn it over quickly to our speakers. So welcome to the webinar series. Our series is hosted by myself, Director of School Mental Health here at TEA, Ashton Millett, our Mental Health and Education Specialist here at TEA, and Tammy Genke, our Aware State Coordinator. We work in the department and the Division of Supportive Schools, working on safety and mental health issues. We're excited to bring you this webinar series on community resource coordination groups today, and looking forward to a just wonderful presentation and panelists to see how that works. I'm just going to give you a little bit of information as we onboard around housekeeping to get started. We are hosting in Zoom format, which means participants cannot show their video or share audio. If you have questions for the panelists that we can see as we go along, please put them in the Q&A function. You'll see a box at the bottom for Q&A. And if you just want to talk to each other or make some comments in general, randomly, please use the chat freely. Feel free to use that. And we'll also keep using it to say hello as you're onboarding. We appreciate knowing who's here at the webinar today. That's very meaningful. Now, I'm asking you, we do have a grant at TEA that funds our mental health work in the agency through SAMHSA called Project Aware Texas, Advancing Wellness and Resiliency in Education. SAMHSA requires us to do a little kind of information about where everyone's at. If you did this before the session, great. If not, if you could just copy that link into your URL or take a picture of the QR code on the screen and just answer those few brief questions. It's going to ask for the name of the training and put community resource coordination groups in that box, please. I think Ashton is dropping the link into the chat. If you need the link so that you can just take that quick survey. It's just going to take about a minute for you to answer those questions. And we just really appreciate you supporting us by taking that link. I'm going to tell you that we're going to take a little exit ticket at the end of the session as well. These are all confidential. Nobody knows who's who, so that's not a problem. So I'm just going to let you just take that while I just kind of continue talking us through. If you haven't registered for other future webinars in the series, we want to let you know that we're wanting to keep you guys aware of when they are. March 8th is our next webinar. You can register for all of them in advance. I think we have top line titles of what the webinars are through June. So feel free to just go in and register, and then you can get those the time held on your calendars, if you will. I believe Ashton will probably drop that link in the chat as well for you, if you would like. So recordings, we will report post-court recordings. Some people want to go back and listen to the recording or share it with someone else. We will also post for you the PowerPoint presentations, all the resources that are shared and dropped into the chat today. I don't want anyone to panic because you're going to get all of those. We'll post those. Now, it may take, as we work with communications, to render the video and get it posted on our school mental health site. It may take a week or two to get that up, so we appreciate your patience. Feel free to copy any links in the chat. Otherwise, you will get them all posted. I want you also to know that you can sign up for our TEA Mental and Behavioral Health Team newsletter. That will come out at a minimum of every quarter. And as we have announcements to share ongoing about grants, resources, other things that might be of interest to you, feel free to sign up for our newsletter and any other newsletter at TEA that provides you with a wealth of information about what's going on around the state and around the agency. Our session today will offer you a CPE credit for educators for the hour. What we need you to do is make sure you stay on the training and listen to the full hour, 11 to 12 today. Spend this hour with us. We know you're busy, so thank you for dedicating this time. Ashton will be sending out your links to a CPE certificate tomorrow. So that will come in your email. We know your email because you registered. So you'll get your CPE certificate and go ahead and download that, and you just type in your name and you're all good to go to save that for your records. So again, in a week or two, the recordings will be posted on the school mental health website. The CPEs come tomorrow. You filled out the pre-test. We did all our homework, and I will get back with you at the end of the session. We do need you to do the kind of post answer for our funder at the end, the exit ticket, and then you'll get your CPE. So that said, I'm going to turn it over to our Aware State Coordinator, Ms. Tammy Genke, to introduce our speakers today and kick off our session. Thank you, everyone. Have a good hour.
All right, welcome everybody. It's great to see so many online for this event. I have been reading the chat as you're entering your information, and it's really great to see the different agencies, the different school districts, regions, education service centers that are represented here today. So we're glad to have you here. Let's kind of jump into presentations right now. So today we're going to learn more from the Health and Human Services Commission about our community resource coordination groups, or some of you may know them as the CRCG. Today we'll have Julia Abreu from the state CRCG office, who's going to share valuable information with us about this great group of agency partners. After Julia Abreu speaks from the state office, we have an amazing panel for great individuals that are going to share about their experiences as they've utilized the CRCG. So without further ado, let's get started. Here we have Julia Abreu. She's with the Texas Health and Human Services Commission, and she's the Community Resource Coordination Group's state coordinator. So we really appreciate you, Julie, joining us today. So I'm gonna stop sharing my screen, and Julie, you can share yours. And again, just kind of as a reminder, if you have any questions for whether it be for Julie or for the panelists, please put those in the question and answer box, and we will do everything in our power to get those answered. If not today during this webinar, then we will gladly do a follow-up. So, all right.
Okay, Tammy, bear with me.
No, it's okay. And if I need to share, I have it ready.
Okay.
So I can do. You want me to do that? I can do that for you.
Let's see. I think I can pull it up here. Let me open it up.
Here, I've got it right here, Julie, if you want to go, and then you can just kind of tell me the cadence.
Okay. Is everybody able to see the main page?
Yes.
Great. Okay. Wonderful. Well, good morning, everyone. Thank you, Tammy and Julie, for inviting me here this morning to speak to you all about community resource coordination groups. My name is Julia Abreu. I'm the CRCG state coordinator with the Office of Mental Health Coordination at Health and Human Services. So I'm going to talk a little bit about CRCGs today. I would like to give you an overview of CRCGs, including their function, their brief history, and review the CRCG process and the benefits of interagency coordination. CRCGs are county-based interagency coordination groups who work with parents, caregivers, children, youth, adults with complex needs to identify and coordinate services and supports. They help people whose needs cannot be met by one single agency and who would benefit from interagency coordination. They strive to meet the person and family's need with community-based solutions whenever possible. Oh, I think we're a little bit ahead here. If you could go back one. Right there. Thank you. CRCGs are organized by the local community. CRCG members include local professional partners from public and private agencies and organizations who know about services in their community. Many CRCGs also include people who have been through the process before, such as individuals, parents, and caregivers. CRCGs host staffings to collaborate with individuals and families to discuss their strengths, unique needs, previous services and barriers, to brainstorm ideas for appropriate services and supports, and to create an individual service plan with recommendations for services and supports. CRCGs bring together a wide array of people, allowing members to share resources and programs with one another, discuss organizational and community needs, and explore solutions. CRCGs can help align service providers and plans by bringing providers together and decreasing duplication of efforts. Because CRCGs gather data and information about a variety of populations and needs, they're a great resource for larger systems, such as systems of care, community coalitions, city councils, etc., to learn about gaps and barriers to services and supports throughout the community. CRCGs serve people based on the community's needs. About 62% serve all ages, either through one single CRCG that serves all ages or separate CRCGs that serve adults and children and youth. CRCGs serve people based on the community's needs. About 62% serve all ages, either through one single CRCG that serves all ages or separate CRCGs that serve adults and children and youth. CRCGs were established by the Texas legislature in the late 1980s to help bridge the gap for children with complex needs and to ensure agencies were coordinating. In 2000, CRCGs expanded to serve adults. There are 8 state agency partners who have agreed to support the CRCGs through a memorandum of understanding, which was updated in 2018. And the agencies, if you click on the different circles, there you go, it'll list out the agencies. So Health and Human Services Commission, the Texas Workforce Commission, TEA, as you know, Texas Juvenile Justice Department, the Texas Department of Housing and Community Affairs, Texas Department of Criminal Justice, and TCUME, and Texas Department of State Health Services, and of course, the Texas Department of Family and Protective Services. State agency partners support CRCGs at both the local and state level. At the local level, agencies have representatives who participate in the local CRCGs. At the state level, the agencies are part of the state CRCG work group, along with community-based organizations and family and peer representatives. And this work group also supports training initiatives for CRCGs. And you can just stay on that slide, Tammy. Thank you. This list is a list of common CRCG members. It can include community-based members as well as local affiliates of the mandated state agencies from the previous slide. And each CRCG can determine who needs to be at the table to meet their community's needs. A CRCG meeting may be the right fit to meet a person's needs if they meet the following criteria. They are currently receiving or have received services in the past from at least one agency or organization, and they need services that the agency or organization cannot provide, or if they need coordination of services between multiple agencies. Okay, next slide. Who can refer? Individuals and families are connected to CRCGs through referrals. The referral may be submitted by a CRCG member, a local agency or community organization, a family or peer representative, or individuals and families also have the option to self-refer. Each CRCG has a unique referral form, so please contact your local CRCG leader to request a referral form for your community. CRCGs typically meet on a monthly basis and as needed when referrals with immediate needs are made. Often when CRCGs don't have a referral for that month, they'll meet to connect, share resources, invite presenters to share about their organization and services, and discuss needs of their community. If there are referrals for the month, this is typically what the staffing process can look like. It begins with welcomes, introductions. The individual, family, or caregiver attends a staffing with participating CRCG members. Members will introduce themselves, identify what agency or services they represent, and the next piece is information sharing. The individual, family, or caregiver will be invited to share what brought them to the meeting and what they need from the CRCG. Members will ask questions to identify strengths, clarify needs, and increase their understanding of the circumstances. The CRCG will ask individuals to share what brought them to the meeting, what types of services they've received before, and how successful they were. They'll also ask what your goals are, what your strengths and supports are, and how the CRCG can support the individual or family. The last part of the staffing is an individual service plan. Together, the CRCG individual, family, or caregiver will identify services and supports that match their identified strengths and address their needs. Based on this discussion, the recommendations will be listed in the individual service plan or ISP. The CRCG individual, family, or caregiver will review the services together and reach an agreement on the plan. CRCGs benefit Texans by offering interagency coordination of services and supports, including basic needs, behavioral health, and caregiver support. This approach allows more people to remain in their own homes and in their communities by addressing their needs proactively and reducing any duplication of effort. Through the coordinated support of a CRCG, more Texans can live with improved health and wellness. Next slide. The state CRCG office is charged with supporting local CRCGs in partnership with our state agency partners. To do this, we focus on 4 main areas: data, communications, training, and technical assistance, and the system of care. For data, we have a data system in which every CRCG inputs local aggregate data. We utilize this data to help inform our training and technical assistance. This data is also used to inform the Texas legislature, the governor, and partner agencies of CRCG efforts and gaps and barriers throughout Texas. This month, our 2021 legislative report that we wrote with the Texas System of Care program and included data from our data system was published and is currently available on our website. In the area of communications, we implement communication initiatives and create marketing materials to increase visibility of CRCGs at a state and local level. So if you're ever interested in getting some of our flyers or marketing materials, please feel free to reach out. We'd be more than happy to send you some. We have flyers both in English and Spanish, and we have a lot of little fun items, pens, keychains, water bottles, all those sorts of things that you're able to pass out at your community meetings to spread the awareness about CRCGs. For training and technical assistance, we provide ongoing training, webinars, ongoing technical assistance, both in person and virtual, to our CRCGs. And with the system of care, we partner with the Texas System of Care to help train CRCGs in best practices and infuse the system of care values of being family-driven, youth-guided and driven, culturally and linguistically responsive, and community-based. How to support and get involved. There are a few different ways. You can reach out to your local CRCG leaders and ask how you can get involved. You could become a member or a leader as appropriate. You can share CRCG information with families and make referrals whenever appropriate, attend staffings, train staff about CRCGs, and tell community leaders about the positive impact of CRCGs. There are many ways to get involved. You can find your local CRCG by going to our website, which is listed on the slide, crcg.hhs.texas.gov. Thank you. And on our website, you're able to type in your city or county and then click the yellow Find button, and it'll pull up your local CRCG, the leaders, and their contact information. Thank you.
Tammy?
Okay, Julie. Thank you so much for that presentation. And if you were not able to get the website, I know Ashton is going to put that in the chat for you. I know one of the questions was about El Paso, so I wanted to put that one in there. So thank you so much, Julie, for the overview of what a CRCG is, what your community resource coordination group is, and how to find information on the website. So we appreciate that tremendously. Please keep using the Q&A button, if you will, as you have questions, and we'll try to get those answered as much as possible. So next, I want to introduce our panel of 4 wonderful individuals who are passionate about the CRCG process. Each one of them has a different level of experience with the CRCGs, and they're going to share their experiences and how it's benefited children and family within their communities, and how it's affected, you know, their students, school districts, and those. So let me pull up my PowerPoint here, and as I give you these introductions. Okay, so first we have Bill Barber, and he is the chair of the Grayson County and Fannin County CRCG. Also want to mention that he was the 2021 Shining Star Award recipient. And then we have Linda Ramos Pettis, who joins us from the Brush Country CRCG, where she is the chair. And so this CRCG covers the counties of Jim Wells, Duval, Brooks, Claybrook, and Kennedy. So as Julie mentioned earlier, some CRCGs do cover multiple counties, especially in the rural areas. Next, we have Santana Variel, who is a school social worker, who's a member of the Brush Country and the Quad Country CRCG. And just to mention that the Quad Country CRCG covers the counties of Bee, Aransas, Live Oak, and San Patricio. So, and also Bowie, Cass, and Marion counties are represented today by Melissa Cook, who's the co-chair of these CRCGs. So Melissa also comes to us from Texarkana ISD, where she is the foster care and homeless liaison. So we appreciate very much that our panelists were able to join us today. I'm going to stop sharing my screen here really quickly so we can see all of the wonderful panelists that we have on today. what we're going to do is, again, I'm going to ask these panelists questions. If you have your own questions, please put them in the Q&A box, because that is being monitored there. Okay. So again, panelists, thank you and welcome joining us today on this webinar. So let's get started. And Melissa, I'm going to put the first question out to you, and then the rest of the panelists, please feel free to jump in too. But Melissa, so tell us about your experience with CRCG and how it's helped your students and families in your area and in your district.
So previously within the district, I was a special education counselor. I'm an LPC. And so I started with our local CRCG to help with my students, making referrals to the CRCG, and quickly became a regular member, and then moved up to becoming a co-chair. It's an amazing way to connect a variety of agencies in one place at one time without 15 phone calls and multiple emails bouncing around. The families can come to us because we are meeting in person again. It was a little difficult during COVID when we were doing virtual, but being back in person, the families can come and actually sit down and really face-to-face meet with all of these different agencies that are on board.
Excellent. Thank you. Santana, let's kind of jump over to you. Tell us a little bit about your experience with the CRCG and how it's helped your students and families.
Well, being a school social worker, working with 8 school districts in the rural areas, the resources are quite limited. So I do my best to link up the referrals I get to the resources that I have gained and obtained. It could be from mental health issues, substance abuse issues. I find that not only the children need help, but it's also as a parent liaison, the parents. There's a lot of needs for the parents, the families. So I do follow-ups when I do link up to the resources, and then we find that there's more that's needed. And so the positive impact that is gained from having a CRCG meeting is just amazing. We bring the families together, the school staff, which entails counselors, principals, diagnosticians, and of course the parents and the children. And then look at what's working and what's not working. What are the gaps? What are the barriers? There's more that's needed. More areas of needs are identified. So with this agencies, interagency involvement, we get a lot of expertise from other staff that are involved in the CRCG. And you'll be amazed as to what other resources you gain. What else can we do? Where else can we refer? And so, and then it also entails resources from participation also. But it's amazing, you know, once you find out what's going on with the family, what's not working, what's working, that we find out what else we can do. I had one experience where we had grandparents raising, by the way, we do have a lot of grandparents raising grandkids that need a lot of help and support. But there was one incident where one meeting where we had a grandfather who was a veteran who was at his wit's end and said, sometimes I go in the backyard and sometimes I think about wanting to hurt myself. I have no other support. So we said, hold on, we got a support for you, which was the vet center. We connected him to the vet center and he was just so happy there was something out there for him too.
Mm-hmm.
So that's what the CRCG does. You know, we have all this information, all these resources to help, and it just has, like I said, has a positive impact.
I appreciate that, Santana, because yeah, you do. You sometimes in a community resource group, you may be staffing a student, but then you find out what the family needs are and able to deal with that too. So thank you so much. Let's jump over to Linda. Talk to us, Linda, about your experience with CRCG and how it's helped students and families in your area. Oh, you're on mute.
Okay. Hi, good morning, good afternoon. My experience goes back with CRCG for about 23 years. It has been tremendous, a tremendous ride. We have, like Santana mentioned, we come together, rural areas, and we got to turn rocks to see what we can find. We base our services on the strengths of the family. We educate our community partners that come to the CRCG. We know why people are coming to the CRCG. Let's concentrate on the strengths, not the problems, the strengths. So that's one thing. Family voice, child voice is very important. Discovering the underlying needs. What are the antecedents to this situation that we are here today? And we start, like they say, peeling the onion. What can we discover? And we start from there. Bridging the gap is really, really important. We have had a lot of successes where we have had families come to CPS and to their doorstep and say, I can't no more with my child. And this is before, we've had other programs that have arisen. And we're like, let's have an emergency CRCG. Let's see what we can do. Let's put our heads together. Let's start calling our community partners. And we do that. And I'm happy to report that these families remain together and didn't give up their child because of the supports that we found. Having that backdoor connection to agencies, because we all know what the need is. And we all respect when we're coming to CRCG, it's because we have tried already what we know of. So let's bring our expertise together. And a lot of that times it's including the family partner, young peer providers in the CRCG, because they have been there and support the families who come, and they come into a big room. A child comes into a big room, it's like, oh my God, am I in trouble? And it's relaxing them and educating that child. We are your partners. We're not here to tell you what you need to do. We're here to guide you in what needs to be done. The phrase, it takes a village to raise a child. This is absolutely what CRCG does. It's testimony that it takes a village to raise a child. And not only are we looking at the child's needs, the parent, the grandparent, natural support. So we have had a lot of successes. Do we always agree on what one agency is doing and not? No, we agree to disagree, but it's always at the end of the day, the individual's need and the respect that we show to each entity, especially the family and the child.
Thank you, Linda. I appreciate that. You bring up a lot of valid points too. And I love the description of it. It does take a village to raise a child. So I appreciate that. So Bill, talk to us a little about your experiences with the CRCG and how it's really helped students and families in your area.
Well, I need to start off by just saying that I'm really happy to be talking to a bunch of educators. I always tell people that my mom was a high school teacher for years in Garland, and my aunt was a teacher in Plano for years in high school. And my oldest daughter is teaching 5th grade in Paris right now. So I'm always awed to be able to talk to educators. So I just wanted to get that out there. The other thing I was going to say is, as far as, what I've seen, I'm going to kind of address it towards y'all educators, just because that's probably what you are. Just remember that CRCG, yeah, it's there to help the families, but it's also there to help the school districts. When you make a referral to CRCG, at least our CRCGs, if you're a school, we want your input. When you make that referral, what we're looking at is a lot of times is the school, and it's usually a lot of times it's a SPED kid, or it's a kid that's been, locked up in one, not locked up, but put in one of the, whatever they call it, the disciplinary units, or whatever, that kind of thing, if they've got it. And they just don't know what to do. They're pulling their hair out. And so when you refer to us, what we try to look at is try to figure out, not only is what's going on in the school something that maybe we could look at a different way, but also we want to look at home and the parents, what can we do? And so we try to get all those people together We try to really look at it from a lot of different angles. That's kind of what everybody was saying before. And I agree with that. We want everybody to be comfortable. I always tell families in my CRCGs that I'm facilitating, I try not to talk too much, but I try to tell them that, hey, this is for you, but this is voluntary. We're not making you do anything. But what we are doing is we're trying to figure out a way so that we can help with these issues that you're identifying to us. And we're going to try to come out of this meeting with a list of ideas. Now, I think it was Linda was saying, I mean, it's not always perfect, but the important part is to come out of it with something. The counties that I'm in right now are mostly rural areas and a lot of small schools and stuff like that. And it's kind of like what Santana was saying, there's just not a lot of resources always, and you got to kind of get together and put them together. And we do a lot of that, but over the years, what I've learned though is with educators is that if you educate them, see what I did there? If you educate them that what CRCG is, they do make referrals. And we get a lot of referrals from, like shared services people and things like that. And when we get that referral, we're able to catch these kids younger and younger. Because that's what I always tell people too, is that, especially when they're working with these families and these kids, we want to catch this stuff as soon as possible. So, there's no stupid referral. Well, what there is there's a referral that you didn't make that maybe you could have, that might have made your life easier. Because I know the schools have it hard. I know that there's a lot of kids coming in the school districts that have a lot of behavioral issues. They've got a lot of just issues at home in general. And sometimes, the school's teachers are like my daughter says, I don't have time for just one kid sometimes. I need to know what to do, and it's sad that she has to say that, but that's the reality sometimes, And so what I say is, yeah, you probably do have time, but we got to figure out how to work this out for you, and so bring the family to CRCG. I probably said more than I'm supposed to say, but that's what I think.
No, I appreciate that, Bill, and I appreciate you highlighting the districts and support, having the educator support and addressing them through that. I appreciate each and every one of your experiences and your passions for the CRCG. I think it really helps the participants to see how it can be utilized and how it can be laid out. Linda, I'm going to start with you on this next question. You had really talked about the collaboration, the networking, the partnerships that CRCG brings. If you don't mind talking in a little bit more detail about the partnerships that have been developed through your particular CRCG, and include the partnerships that have been developed through your various school districts.
Yes, ma'am. Well, the partnership stems from making a simple phone call, not having to wait for the meeting. Not having to wait for one of our meetings is the second week of the month, the other one's the third. Let's not wait. Let's see what we can do right there, right now. Let's pull it together. So we start those phone calls, we start those connections. We do a lot of education at the beginning of our CRCG meetings. We do education and we bring in trainers. Throughout my tenure, I have built a lot of collaboration in visiting the schools, in educating what CRCG is about, the importance of support for the school. It's a community resource group, not a mental health, MHIDD. It's a community equal partnership. So we start making the phone calls. We start, Santana calls me whatever time. And that's because that's the relationships that we build. And Bill, you did mention what a family member said. I can't just take care of one kid. You're right, they can't. And I commend every educator for everything they do every day. But I think the knowledge of spreading the information is collaboration is key. Collaboration is key. So just, at the beginning of the school year, we'll send out information. We'll mail out, we'll give reminders, we'll send reminders. We do presentations, even at fairs. school fairs, beginning of the school year, we have our community relations person has the educational material needed to present to our community, and then the phone calls start from there.
Excellent. Thank you, Linda. I appreciate that. Melissa, I want to jump over to you. I know, yeah, you as a school district employee and being a part of the foster care liaison and McKinney-Vento liaison and things of that nature. You mind talking a little bit about the partnerships that you've been able to develop, whether it be within your ISD or within the 3 counties that you serve as co-chair?
It's a little bit of both. Within the district, we have been lucky enough in the past and currently to have one of the autism grants through TEA. And so we try to incorporate their family engagement specialists, their behavior support staff, so that we can provide staff support not only for the CRCG, but it's just a shared collaboration of information. We pass information back and forth. The grant does a lot of training, so we're able to jump on board with that and partner up. We also have a great local mental health agency who is, they make up probably 4 of our CRCG members, because each special program sends a representative to be able to sit at the table and help us from all of those different angles. We have juvenile justice from Bowie County and Cass County that participate regularly. We have agencies come in and do presentations to family and to the committee themselves on a regular basis. It is a powerful networking place. School districts come in and do referrals, and they'll bring extra staff in so that they can see what's going on. It is an invaluable resource. And so many in our counties, because we are so rural, don't know about CRCG. And so we have to work really hard to share that information, to get those referrals coming in so that we can help the residents of all 3 counties. We typically meet in Texarkana because it's just the most local place and there's plenty of meeting space here. And most of the state offices are here in Texarkana as well. So it's more convenient for that. So families do have to travel. We meet on the 2nd Wednesday of every month. So that would be this afternoon. We're in the middle of a horrible storm today. So, some of our families have chosen not to drive this time. So we're just rescheduling. And if things come up, we have emergency staffings. We try to be as available to the community as possible as a committee.
Excellent. And availability is key too. And I know COVID kind of changed a little bit of that. I know that most CRCGs were face-to-face, and then when COVID happened, did a online format. And I know that some of them are even hybrid, just depending on that. So thank you for being so accessible, to your community, for those referrals. Tina, do you mind talking to us a little bit about the partnerships that you've developed through the CRCG?
Well, like Linda was saying, we do a lot of collaboration, and being able to have all these agencies, like I work for the schools, and that partnership we have is very crucial, very important to have with CRCG, because some of the school districts, and really needed added support, this extra support to be able to identify resources and come up with a solution to help with the student, the issues they're having, and also to provide information for their staff. What are some things they can do, and find out what they are doing that maybe need to make some changes, but also provide support and education for the staff, or things they can do to help their students and with the issues they are having. But there's partnership that is very crucial, very important, and other agencies that are included in the CRCG meetings. It's amazing what we can do, how we can resolve issues. And then the positive response I'm getting with some of the parents, it's amazing. Like, God, we got a lot of people that really do care, and they are doing something now, not waiting. I can cite an instance where Linda Perez, the youth service mental health director, we found out the student had a psychiatric appointment like 6 months, waiting 6 months. And she said, no, let's see what we can do. We can get an earlier appointment because the student really needs to see a psychiatrist, and she made it happen. So these are some things that we can do.
Excellent. Thank you. I appreciate that. Bill, I'm going to change up the question just a little bit because I know you have a wide range of experience in multiple county CRCGs. Will you talk a little bit about the particular partnerships that you have, like what agencies are primarily joining your groups?
So if I think I understand your question, I think, as far as partnerships go, my goal with the groups that I facilitate and whenever I get a chance to help out with other groups is just to make sure that there is a wide variety of agencies attending. And that sounds simple, but what we end up with a lot of times in some of these CRCGs is we get the same people coming over and over again. And that's good. I'm not saying that. I mean, there are people that are supposed to be there, and I encourage them to be there as well. But I think it's important that, just to constantly be reaching out to, either new counselors in the area, like in our counties, one of the things that people are always asking about is, how do we pay for counseling for my child? Now, what we got is we got kids that sometimes aren't on Medicaid, so they may not even be on private insurance, probably. So what do you do? But the kid really needs to have some counseling. The family is pretty destitute as far as their funding. Well, I try to reach out to, who is it that the state is funding to help with, counselors, in the area. And usually there's somebody that's funded by grants, or there's somebody that's funded by some kind of thing from the state that we can access. It may not be like totally, all the time counseling. It might be a limited number of sessions or whatever. But I always try to stay in touch with those groups because we always get that question. And sometimes that's the way to, get them into counseling. The other thing that a lot of times is that also goes along with it is that I try to have relationships with, a lot of the state agencies, like people that know about Medicaid. I know about Medicaid, but there's stuff I don't know. I don't know all the secrets. And so I like to know, who at HHSC, can we have as a contact? Maybe they could send somebody to the meeting. Who is it at juvenile probation that we can have a relationship? Do I need to know the chief, or do I need to know the caseworkers? Well, probably all of them, but I want to have a good relationship with the chief. Do I know the sheriff in town? Do I know the chief of police? I want to, and even in bigger towns, that's good people to know those people. Encourage them to send somebody. I know that, like when I was attending, or when I attend the one in Plano, they actually have representative from individual PDs. They actually have social workers that work at the PDs that come. Guess what? That's great, because we have a lot of kids with autism that run away, and the police have to deal with that situation. And the family comes back to us and see ours, and they think, oh, what's going to happen? DFPS is going to take my child away. Well, maybe not, but we need to figure out what to do, to keep your kids safe and keep you safe, And so we might call a meeting with them and DFPS and all those folks, but then also have that person from, the PD there, and the PD person would say, well, we have a program for families that have autistic children, where we can track these kids, when they run out of the house, and they know how to work with these kids so they don't scare them off, make them run in front of a train or something. But, things like that, those are the kinds of things you can tell I'm a social worker, but the kinds of things that I build up in life, those are what I build up in these groups is, I just want to know everybody that's in the community that works with whatever, it might be, a police person, or it might be, I've had contact with people that do things in law, like as far as lawyers, because sometimes those are the ones that, might be working with these kids. They might be coming to the meeting. Who's the person that handles the local food shelter? Can they come to the meeting? And I've asked that question. They don't always want to come, but sometimes when they come, or what about, I know this, some people, may never think of this, but the local pregnancy center. It's a great source of diapers sometimes. You can figure out a way to work it out with them, stuff like that. Just think about all these different things, because what CRCG, somebody had said something about a one-stop shop. I don't think that's exactly what we are. I think what we are is we're somebody that's going to enable the families to be independent. I don't like to talk to it about, just us doing stuff for them, because I always start off my meetings saying, yes, we're going to tell you this stuff, and I want you to ask me if you don't understand it, but just realize that if this stuff gets done, part of it is going to be, you're going to have to help. I always tell people that because I think somebody else was asking the questions, you're like, how long it take for a referral and all that stuff. Well, it can be really quick, or it can be nothing is going to get done. It depends on whether that referral is made. It depends on whoever's making the referral actually gives us the information with the signature from the family saying that we can meet. It depends, if the family wants to be there and wants to follow up. We try to convince them that they want to be there. Sometimes they don't want to be there, and that's okay too. But I always tell them, I said, we're going to give you this information, but for this to happen and for us to help you, you've got to buy into this a little bit. If you don't buy into it, then, come again, maybe you'll buy into it next week. But, right now we're just not, talking in the same language. But I do agree that, yeah, connections is everything. What kind of people they are, I think it could be. I've had teachers, I've had teachers' aides, I've had in my class, in my groups, I've had gym teachers. One week I had a gym teacher because he was concerned about this kiddo, because it was the only one that could work with this autistic kid in the campus, so just think about it outside of the box. Just realize that, that we're not trying to reinvent anything here, but like I said, the way I look at it is we're trying to be smarter about how we use the resources that we have, and make sure that we've turned, like somebody, I think Linda was saying, have we turned every stone? I like that. That's a good phrase for it. Have we turned every stone? Because I can't remember all the resources in counties, and I'm sure that the rest of us can't. I just can't. Even if I had a list, I probably wouldn't always remember which one to refer people to. But when I get those people together and we got that magic going on, it's kind of like a symphony to me. I'll sit here and point at somebody and say, what can you do about this? And they're like, in the headlights, but then they're like, oh yeah, I can do this, and so that's what we do.
Yes,
We go around the room, we
we
get
are
all the
better.
stuff together. So I'm going to get off the phone now.
No,
right.
you're fine, Bill. Yeah, I was just saying together. Yeah, together.
Well, I'm just saying I could go on for hours about this, but I'm just saying that's what it means to me and how it works. And so, yes, I'm passionate about this, but I'm passionate because I've been doing it so darn long.
Yeah. Well, no, and
You're muted.
oh, sorry. Thank you. It flipped off. Thank you. So, I appreciate all of you and your expertise and your experience. I've had the blessed opportunity of chairing a CRCG for about 9 years, and it is a wonderful opportunity, and you get to see really great things. Really quickly, because I know we're running out of time. I wanted to ask, just really within the last like a minute, if one of the panelists wanted to pop on and give us any feedback that parents or students or even districts have given you. If we could just have one little nugget of positive feedback. Okay, Linda, I see you raising your hand. Go right ahead.
The feedback is like, I was at my wit's end. Without you all, I couldn't be here where I am today, and the tears just roll down. And that is the energy that the group brings together, passes that energy on to the family.
I love that. I appreciate that very, very much. There's a lot of great things that come out of the work of the CRCG. So again, panelists, I appreciate you so much. I wish we had more time to tap into all of your knowledge and expertise, but I really, really appreciate you all being here and joining us. And if there's any questions and answers that we didn't get answered through the panel, we will make sure we address that and get those answered. So with that, I want to throw things back to Julie Wayman, who's going to end our webinar today.
I just wanted to say deep gratitude to all of you for participating in this webinar and for this information and just sharing the richness of what CRC can do. I want to say from my past, from my camera on, from my past life, I've participated in CRCGs before when I worked out on the field and saw it help so many families. I think it's important to repeat that this is a voluntary initiative in our state. And, as someone working at TA now, after having worked in school districts and agencies in the past and seen it work with families and students, to realize that employees who work in different agencies voluntarily get together like this to network, like you talked about, sharing resources and uncovering what's in the community is one of my takeaways. And I also heard, like Santana, you started out talking about that, and all of you did, Bill and Melissa and everyone. You sometimes have to find and build and even develop things like Linda that might not even be there, or we might not be aware of what we can patch a family into, or we help them figure out how to problem solve things. And just knowing that people care and you sit with them around the table, and me as a parent, I know that would make a huge difference to me, knowing people like you were in the community. So I want to have gratitude to you all for that. This is not funded, and I want to say that it is unique in the country. Would you say that, Julie?
I would, yes.
Right? And it's one of those bright spots that Texas has. And when I look at the map that Julia shared with us, how covered we are in the state. I worked 15 years ago, even with CRCGs, when we were trying to build them up again, when I started with the state, and it took a while. Okay. And I'm happy to see how far Julie's got it. Now, let me move the slide, if you would. It's already been done by Tammy. I need you all to take the post survey. And then when you take the post survey, you are going to be good to go. We appreciate you supporting this process with us. Ashton is also going to share some other links in we got the Qualtrics link there. Take the post. Register for other webinars. I want to make sure to share our fentanyl awareness resources with you. They will be on our resources that we share out when we put the deck out. One of the big things at TEA that we're trying to do, and when I think about the community resource coordination groups, even, they get issues coming to them around substance use and other problems that are happening in their community, and how can we solve resource issues in that way. Fentanyl is a big issue in our state. TEA here in this webinar series wants me to make sure to kind of keep that out in front of us. We spoke about that quite a bit at the last webinar. So I'm going to keep that toolkit out in the information about one pill kills, so that we can save lives of family and youth. CRCGs can also be very helpful in sharing that information with each other about how we can help our families stay strong, resilient, and from getting swept under a bad situation where a child can be hurt, or a parent or a family member and by this dangerous chemical. So we're going to share those resources with you. It's 11:59. When you click on the fentanyl emails on the fentanyl awareness page, it says it cannot be found. I don't exactly know what that means. Ashton will drop the toolkit in, and all the resources are there at the TEA website. So maybe we'll just drop the TEA communication toolkit in one more time for you all. So you have all the tools we created from the toolkit. And just thank you for the cooperation and the encouragement you give to families, and for everything that you do. It's inspirational, each and every one of you, what you're doing in your communities. And Julie at the state. TEA is happy to be a part of it. Have an MOU with you all to do this work. I love to see MOUs and relationships with ESCs, school districts, and to use this as good wraparound supports for our families whenever we can. So thank you all for all you do, for coming to these webinars, taking the hour out. You're the people who care. Spread the word. Thank you so very much for taking this time to learn, share information with each other, panelists and attendees. Appreciate you all. Have a great day.